My name is Andrea Shea and I'm a registered nurse. I'm the on-site nurse here at Michigan Cerebral Palsy Attorneys. I currently review medical records. When I receive the medical records, it takes me weeks, sometimes months, to go through, review, and look for potential mistakes that may have occurred in the labor and/or delivery period. In many cases, the signs and symptoms of cerebral palsy are not easily recognized. For many families, the first sign would be a developmental delay. Pediatricians are trained to assess for key developmental milestones through infancy and early childhood. If an infant does not meet a milestone, it does warrant further investigation. Potential signs during the newborn and early infancy period are critical. If a baby fails to breathe immediately after birth, that can be a sign that a baby may be at risk for cerebral palsy. If a baby experiences seizures in the first 4 weeks of life during that newborn period, that is a potential sign for cerebral palsy. When babies are born, if they exhibit a lack of muscle tone, they're often referred to in a term called floppy. A baby with poor muscle tone or muscle weakness is demonstrating a potential sign for cerebral palsy. If a baby is having problems sucking in that first month, that is a developmental delay. Babies are born with a sucking reflex and they should be proficient at sucking from the hour that they're born. So difficulty swallowing, difficulty sucking in that first month is a developmental delay. If a baby fails to blink at loud noises by the age of 1 month, that is also considered developmental delay. Babies should be tracking people and objects, so faces, toys, by the age of 2 months. If a baby's not tracking objects by 2 months, that is considered a developmental delay and potentially a deficit in vision. Infants should be rolling over by the age of 6 months. If a baby is not rolling over from tummy to back or from back to tummy by the age of 6 months, that is considered a developmental delay and it could be a sign of cerebral palsy as well. Babies should be able to sit without support or sit independently on the floor by the age of 9 months. If a baby exhibits a developmental delay, it warrants further investigations. Pediatricians should at that point be referring babies to specialists. If your baby is experiencing developmental delays, a specialist such as a pediatric neurologist, an occupational therapist, or physical therapist can help evaluate to see if your baby's developmental delays are associated with a neurological injury. For more information on potential signs and symptoms of cerebral palsy, please refer back to our website. We do have a thorough list with the definitions and explanations that can be very helpful.